Hey guys, Dr. Adil here. Today I want to talk to you about mental health and bodybuilding. So the reason I want to talk about this is because recently one of my friend's cousin, who was an anabolic steroid user, actually committed suicide. So she had messaged me and we were talking about mental health and bodybuilding and if there is a correlation between the two. And so that's a big part of the reason why I want to dive into this and hopefully help someone to prevent this from happening. And so obviously this affected me quite a bit, and she messaged me and we talked about it, and I've just been supporting her. And so I thought it'd be a good idea to make a video to hopefully help people who are maybe suffering with mental health and maybe some things that they can do to help with this. And it's not only her cousin, but actually a lot of my professional athletes who are high-level bodybuilders. I've consulted on the top bodybuilders in the world, and many of them are actually suffering with mental health, especially right now with COVID and everything going on in the world. So let's get into why it's so common and what we can do about it. So I think the reason why we see more of it in bodybuilders is because of the anabolic steroids. We don't know exactly what the mechanism is, but there definitely is an increased risk of suicide and depression in anabolic steroid users. And so as a physician, if you're looking after someone who's using anabolic steroids, it's important to screen them for depression or for some sort of mood disorder on a regular basis. So it's something that they may not mention, so it's something you sometimes have to screen for by using a screening tool to ascertain if they may be suffering from depression. So once you've diagnosed it, or once you think that someone is suffering from it, what kind of things can they do to actually help with it? So my approach to depression is through three main things: neuroinflammation, increasing neurotransmitters of serotonin and dopamine, and then also improving gut health. So those are kind of the three main overviews of how to treat depression. But conventionally, the way most people do it is just to focus on the neurotransmitters, which is serotonin and dopamine and norepinephrine. That is one part of it, which the drug therapies often help with, and there are certain supplements that can help with that too, but that's only one part of depression as we're learning. And so a lot of those therapies are actually not that effective, and there's actually a large trial done, and they found that it's actually not that much more effective than placebo. So the reality is it may have some benefit, but in most people from mild to moderate depression, it's actually not that effective. And there's certain things like exercise that may be even more effective than just than drugs. Of course, there are certain people who can benefit from it, and so that's something you should talk to your doctor about. But my focus is really on a more holistic approach. So let's get into neuroinflammation. So a lot of people have heard of chronic inflammation affecting joints, leading to cancer, heart disease, but it can actually lead to depression too. And there was a good study that came out last year showing that the Mediterranean diet, which is more of an anti-inflammatory diet, can actually help to reduce symptoms of depression. So that highlights the fact that there is an inflammatory component to it. And not only that, there has been studies looking at curcumin, N-acetylcholine, omega-3 fish oil, vitamin D3, all these things, if they're low, they can increase your risk of depression. And there's actually been studies using these supplements to improve depression symptoms. So supplements can be part of a good treatment protocol for depression in addition to psychiatric medications. Now, the third component that's often overlooked is the gut-brain axis. So you actually have more serotonin receptors in your gut than you do in your brain, meaning your health for your brain starts in your gut. And so if you have dysbiosis or imbalance of your gut bacteria, then that can actually lead to poor gut health, and then that can lead to decrease of serotonin, and then ultimately that can affect your mood. And so the gut-brain axis is really important to take care of, and it's not always as simple as just taking a probiotic. My generic approach for most people to optimize their gut health is to look at this book called Healthy Gut, Healthy You. It's by Dr. Michael Ruscio, and it has a very good systematic approach on how to improve your gut health for the general population. Now, if you're suffering from something more advanced and that doesn't work for you, then you need someone like him, a gut health expert, to work with you to individualize and customize a plan. And a lot of people just say, eat well and take a probiotic and take some fiber and then your gut health will be fine. But that doesn't always work for everyone. Personally, I actually had gut health issues too. And the way I fixed it was using the Healthy Gut and Healthy You approach. So that was essentially using a really good digestive enzyme and then using a really good high quality probiotic and also what's called a soil-based organism probiotic. And then also using a prebiotic with all that. And so that was able to help me, but again, you have to figure out an approach that works for you. Now, this video wouldn't be complete if I didn't talk about some of the new treatments for depression. As I mentioned earlier, SSRI and a lot of psychiatric medications aren't actually that great. And so there's a lot of new research in looking at psychedelics. So the big hot topic right now is Psilocybin, which is actually derived from shrooms. And so they've been using that for refractory depression and even for psychotic depression and for PTSD. And it's being quite effective in conjunction with therapy. And unlike those SSRI medications, this can lead to almost like a rewiring of the brain. So it can actually lead to long-term improvement in depression. It's almost like what they used to do for electroconvulsive therapy, where they actually used to shock people, and they still do that, but this is a much less invasive way to do that, and a therapy that has potentially a lot of side effects. Whereas the psilocybin assisted therapy has minimal side effects. Similarly, there's something called ketamine infusions, which is a drug that can help rewire your brain as well. So you can do ketamine assisted therapy, and it can kind of give you that similar type of what's called dissociation, allowing you to do assisted and guided therapy to get over previous trauma and emotional damage that might be causing your depression. So it's actually a very exciting time for psychiatry because of psilocybin and ketamine and all these new therapies that are up and coming. I'm very excited for the field, and I think it's really going to evolve with these therapies in conjunction with the lifestyle stuff that we talked about. So, so if you are suffering from depression, you're not alone. There's millions of people out there, including a lot of high-profile athletes that I deal with and very well-known people in the YouTuber communities and people all around the world who are suffering. And so it's not something that you should fight alone. Try to find a good support group and try to do these different lifestyle changes in conjunction possibly with the medications, and hopefully this video helps you guys. So if you have any comments, leave them down below and subscribe for more videos.